If you've ever experienced hair thinning or hair loss for any reason, you will want to listen to this episode. Dr. Caroline Day is back. She's our hormone therapy expert, and she's diving into the topic of hair loss and thinning.
First, here's some reassurance. It's completely normal in perimenopause. But why is it happening? Is there anything you can do to reverse it? And what actually works? Because there's a lot of marketing in this space that sometimes feels gimmicky. Let's dive in.
Caroline J. Day has been a physician for over 35 years and is board certified in family medicine. She graduated from the University of the Witwatersrand in South Africa in 1988 and went on to gain extensive experience in pediatrics, urgent care, psychiatry, and geriatric medicine while living and working in South Africa. She also practiced in the United Kingdom in hospitals in and around London. In 2002, she and her family relocated to Tuscaloosa, Alabama, where she continued her medical career in the United States. In 2015, Dr. Day became board certified in anti-aging and regenerative medicine. She is a member of the American Board of Family Medicine, the American Medical Association, the Medical Association of Alabama, the Menopause Society, and the American Academy of Anti-Aging and Regenerative Medicine. In February of 2017, she opened Tuscaloosa Integrative Family Medicine in Northport, Alabama, fulfilling her dream of creating a practice that provides exceptional primary care for both acute and chronic medical conditions, as well as hormone therapy and personalized weight loss care. Her passion is preventative and integrative medicine, helping patients not only live longer, but live better. Her approach blends evidence-based traditional medicine with modalities such as bioidentical hormone therapy, nutrition supplementation, and detailed life-changing patient education. Dr. Day has been awarded top family physician in her local area for the past 6 years and was recognized as the top family physician in the state of Alabama in 2022. In 2024, she completed a fellowship in anti-aging, metabolic, and functional medicine and became a Menopause Society certified practitioner. Outside of medicine, she enjoys traveling and bicycling with her husband, watching movies, baking, and spending time with her adult children and elderly father. Dr. Day, you are back. This is so exciting. You have your book. It is called My Menopause Makeover. Mm-hmm. But it is what I almost said the tagline, but the subtitle is what every midlife woman needs to know about hormones, energy, and healthy aging. Carolyn and I spent some time looking through this. Carolyn is a true expert in what is in there. And the last time you were here, you mentioned hair loss briefly.
Yes.
So we are going to
thinning, yes.
Talk about hair thinning and hair loss.
Okay, so let's talk hair loss because I know this is a big issue for a lot of women, particularly, I guess, starting late 30s, but particularly in the 40s, maybe 50s.
Right.
And I don't remember, so I'm 49, which means I was, during COVID, I was 6 years, 43.
43, I was 43. Yes. Beginning of perimenopause.
Yeah. And I wasn't having hair loss or hair shedding at the time, but all my friends started to talk about it.
Yes.
And we couldn't figure out, we were like, is this COVID causing us to lose hair? Is this hormones? But the shedding and hair loss conversations with my friends have continued, and more people are participating in them. So it can't all be COVID, blame it on COVID. So can you tell us, how do hormones influence our hair growth and then hair shedding?
Right. Okay. So, yes, so once you enter perimenopause and hormone levels start changing, it's more to do with the ratio in terms of like estrogen dropping, and even though testosterone drops, we tend to convert some of the testosterone into DHT, more so when you hit perimenopause, and the hair follicles get really sensitive to that. So, well, not everybody. I would say about 50% of women are sensitive to the sort of testosterone-related hair loss.
DHT,
the DHT, yes.
Harmful to the hair, or they get more sensitive to it?
Well, it's just that, yes, it changes the follicle size, and so the hair starts actually, yes, it starts thinning. So you often find in perimenopause, even just the structure or the texture of the hair changes. So it's really more to do with the aromatization of the testosterone to DHT. And for example, I mean, a lot of that happens in polycystic ovaries, but once we hit perimenopause, we tend to get more of that going on. But not everybody is sensitive to it. So testosterone-related hair loss is more kind of just here in the frontotemporal areas.
Okay.
And you would think it wouldn't be like that because with perimenopause, your testosterone levels actually decrease. But it's just because of the aromatization to the DHT. So you tend to have more of a ratio of that. And then you also have all the fluctuations with estrogen. So definitely perimenopause, going into menopause, you see that sort of testosterone-related hair thinning in the frontotemporal areas. I mean, there is female-related hair loss, female alopecia, which is more kind of just on the top of your head, central, and then that's genetic.
Oh, I'm so sorry.
Yeah. And, you know, often, like, say, for example, if you're in church or at a music concert or theatre watching a play, if you're sitting at the top and you look down at all the ladies' hair, you can kind of tell all the ladies that are aging just by that hair thinning.
Yeah.
But so that's kind of normal female hair thinning.
Kind of the ratio of these hormones that are changing
yes,
leading to this.
But I mean, in the 30 years that I've practiced medicine, without a doubt, the last 6 years, hair thinning has almost become an epidemic.
Really?
I've never seen so much hair thinning as I have, really, since COVID. So COVID was a huge cause of hair thinning. I mean, really, essentially, almost without fail, 3 months, 90 days after getting COVID, most people experience generalized hair thinning. Wow. So, and then the other big cause of hair thinning right now is the GLP-1s. With the weight loss.
That's right.
I didn't even think about that.
I have a friend who lost a lot of hair.
Is it the lack of nutrients that you're not eating that causes that hair loss, or something else?
It's as soon as you lose 30 pounds, it seems to trigger hair thinning. So we've seen a huge amount of it. I mean, myself, in the last 2 years, I felt I've lost my hair 4 times. One was because I had a rotator cuff surgery. That's another thing. If you have surgery 3 months later, it's the anesthetic and just kind of the stress on the body generally. And then I lost it again after COVID. Then I had another surgery on my foot, and then I lost some weight. So my hairdresser was saying to me, oh my gosh, you've got like 4, almost like edges of hair, you know,
of new growth.
And so one of the commonest things I usually ask my patient is, how much do you think you've lost in terms of your ponytail? And so
a lot. I've lost a lot.
Yes.
Like the thickness of it.
Yes. I mean, I think I lost up to 2/3 at one point. But the thing is, it does come back, thankfully.
How long does it take to come back?
Oh my gosh, at least 6 months. Potentially up to a year. And then, of course, it depends. I mean, the last time mine was just growing back, I was like, oh, and then I got COVID. I was like, oh, my gosh, I'm going to lose my hair again in 3 months. And sure enough. And then the other thing that I've noticed, and I've seen it on some of the TikTok with hairdressers and things, and even for myself personally, is just female aging and menopause. You tend to lose a little bit more in the front here, and the back still remains really thick. Yes, which is exactly how I feel. Mine's grown back, but really thick at the back, but it hasn't really thickened up so much in the front. So I almost think it's becoming like a normal part of aging. But the good news is there are things we can do about it.
Let me ask you about one more thing. Can thyroid issues?
Oh, yes, thyroid, of course.
Trigger.
Yes. So when I see a patient who's got the hair thinning, I automatically check their thyroid because even subclinical hypothyroidism, you know, your labs might look good, but maybe your body temperature is a little bit low. Thyroid has always been the number one issue It's kind of got lost in the shuffle because we've had COVID and all this weight loss, et cetera, et cetera.
In the past, that was the number one thing
thyroid,
you went to.
yes. Okay. And then the other big one is if your iron stores, your ferritin is less than 50, you're almost guaranteed to have some hair thinning. So I always check a ferritin and thyroid, hormones, DHT, and then obviously do a thorough history in terms of, have you been on a GLP-1, have you had COVID or flu, surgeries, that kind of thing. The other big trigger for hair thinning is childbirth. So a lot of women will lose their hair after childbirth, but that also grows back pretty quickly.
Like in droves. Like
in
droves,
like yes.
Clumps come
clumps
out.
Come out, yes.
Oh, wow. I didn't
Postpartum.
But
you
then...
had it?
Yeah, and I would say every single one of my friends, massive clumps came out in postpartum.
And then generally it grows back normally.
Yeah.
It's just the perimenopause, menopause one. The hair does tend to come back in a little thinner, and maybe you might get a little curly hair or frizzy that you never used to have. And it's because the actual DHT is actually kind of almost shrinks the follicles. So there's definitely a change in the follicle structure hormonally. You're not going to see that so much with COVID or GLPs. You're just really getting generalized. And thyroid and low iron, it's more generalized hair loss. Then, of course, the female pattern, which is really more at the top here, I mean, that's genetic. And I mean, you can treat that. But that can be a little harder to treat just because it's basically genetic and kind of programmed into you.
Okay, so I've had a weird hair thing occur. Back when all my friends started talking about hair loss, I wasn't having it. And I was like, I don't know what y'all are talking about, But what I did start experiencing, and it was probably at the very start of perimenopause, I just didn't know I was in it.
Right.
Is I've got these patches of hair like underneath that are curly.
Yes. Oh, yes.
I've had the straightest hair my whole life.
Yes, me too. If you lift it up here, you have all these like curlies coming through.
It's underneath. Yes. What is that?
That's a change in the structure.
Okay.
As you're going through perimenopause, yes.
It was the weirdest thing. And then about 2 years ago, I started having some hair loss. I've always had very, very thick hair, so it really didn't bother me, except for the fact I'm so sick of cleaning it up.
Around
my bathroom and sink and shower and
block drains. Yes, I mean the one advantage of it is when mine falls out. I mean, it only takes me half as long to blow dry it, which is quite nice for what it's worth.
Yeah, cuts down on the hairstyling
time.
time.
Find the positive.
Yes.
And I even saw on one of these TikTok hairdressing, midlife women, they actually will almost like thin your hair for you at the back to kind of make it match more with the front to actually look good. That was just something that one of the hairdressers was talking about.
Yeah. Interesting.
Yeah.
Okay, so when someone comes to you, and I'm assuming they're coming to you with several symptoms, but if they're saying, I'm losing so much hair, I haven't had this before, or it seems more excessive, where, as a doctor, where is the first place? Do you have like a checklist kind of in your mind? Like, okay, let's check this, and this, and then let's rule out this, or how do you kind of break it down?
So I go through the whole history and just see where they are in terms of age, perimenopause, if they ever had a thyroid issue, family history, have they been anemic before, have they had COVID, flu, surgeries, are they on a GLP-1, et cetera, and then generally I will check labs, and then I'll do the thyroid in depth. I'll check a TSH along with the T3, T4 and antibodies. So I found with Hashimoto's as well, even if the antibodies are elevated but their thyroid is normal, you might have some more hair thinning just because of that. And then also there are some other weird and wonderful autoimmune things that can cause hair loss. Like if somebody's got lupus or any of the autoimmune things, it does sort of increase your risk of thinning hair. So I'll check a blood count, I'll check the thyroid in depth, I'll check the hormones, I'll look at a DHT level, maybe a DHEA, which is a precursor, testosterone, and then definitely the ferritin. You cannot believe how many women's iron stores are less than 50. And often when you just replace some iron, it makes a huge difference, and your hair can start coming back.
It's so funny you say that, because I feel like I've seen so much lately in my social media feed. I think I was mentioning it to you, Brierley, about ferritin, and I'm like,
yes,
did I miss something new about it? So we'll have to have you back to talk about that on another episode. But
yes, it is. I'm also
intrigued.
noticing it. Even if your hemoglobin's okay, but then your iron stores are low, that is essentially the thing that's causing some of the hair thinning.
Interesting.
Okay. So you'll do the full kind of lab breakdown.
Right. Yes. And then I'll have a look at the hair and see what it's looking like. Where is the pattern of hair thinning, breakage, that kind of thing. Okay. And then depending on that, then we can decide how we want to treat it.
Okay. Well, that gets us to our next.
Yes. I was going to say, this is where I start to have a lot of questions.
Okay.
Yes.
Are there any treatments that actually have good evidence behind them? And this can be anecdotal based on as well as scientific. Or what should women look to?
From a hormonal point of view, in terms of reducing the DHT, or at least reducing the effect that it has on the follicles, spironolactone works like really well.
What is that?
So spironolactone, it is, yes. So it's an old-fashioned diuretic that we use for sometimes complicated blood pressure. I mean, you can use it in liver disease for ascites and that kind of thing, but nobody uses it for that anymore. Basically, spironolactone is used by the dermatologists and the OBGYNs all the time for hormone-related hair issues.
So this is like a prescription medicine, not a supplement? Okay.
And then it also, so we use it a lot in polycystic ovaries because of, so the nice thing about it is it helps get rid of the cystic acne, which is from testosterone in polycystic ovaries, and it also gets rid of the unwanted facial hair growth. But it promotes the growth on your head.
Okay. Interesting.
So spironolactone is our number one that we use for any hormone-related, particularly anything to do with the testosterone. So I use it a lot for my patients who are getting testosterone therapy. If they getting the, as I say, we do balance out the levels as much as we can. But, if they're starting to get some bothersome facial hair or bothersome hair thinning at the temples, we'll use some spironolactone around about maybe 50 milligrams or 100 milligrams a day, and it usually fixes that right away. Usually.
And do you have to stay on it?
Yes.
Indefinitely? Or as long as you want to keep your hair?
As long as you want, yeah. And then, I have patients who'll come off it and go back on it, but we use it off-label all the time. It's probably used the most as an off-label medication for unwanted hair growth and hormone-related hair thinning.
I just looked it up. It says it's used off-label for treating acne, PCOS, and
hirsutism, which is the unwanted facial hair. And even like with polycystic ovaries, where people get, kind of around their nipples, on their abdomen, that kind of thing, it gets rid of all that unwanted facial hair. So it's really nice in terms of it promotes hair growth and gets rid of the one that you don't want. You can also use it topically, like, with the compounding pharmacies and things, they might put it in a topical application. They may add something like finasteride with it, minoxidil with it. But generally it works best as an oral.
Okay. I took so a couple of years ago, I started having like crazy breakouts in the spring, and they were like they just
cystic,
pop up,
they're awful.
Within an hour.
Yes, correct.
I walk out in the morning and there were none, and then so I went to a dermatologist and she gave me a drug. I don't know what it was. I'm wondering if it was this. Although I would have thought she would have told me like it was for blood pressure and we're using it off label, but I realized I stopped taking it maybe after a month and a half because I slowly started to realize, or maybe I finally looked it up at what I was taking, and it was making my testosterone
low
tank, and I had zero sex drive and just the energy drops, and so the doctor was probably just out of her residency. She's not thinking hormonal change. And I was like, well, wait, I'm paying to get testosterone from Dr. Day. I don't want to take this.
Yes. So you do just have to work. Yes. So that would be one of the negative aspects. But generally, we're kind of going to dose the testosterone and the spironolactone in a way that you still feel good, basically, and it still works.
So basically, I need to communicate with my doctor.
Yes. And she might have put you straight away onto 100 milligrams, which a lot of doctors, I mean, I find the 25 and the 50 work pretty well. Yes, but the other thing with spironolactone, it can increase your potassium level. So we do like to check a potassium level maybe every 6 months or once a year. It happens very occasionally that's a problem, but it is something to be aware of.
Okay. So what else? Or should I go through the long list of things that I have tried and my friends have tried and ask you what you think?
Okay. Well, we can look at the prescriptions first. So spironolactone for hormone related, then minoxidil has been around for a really long time. We all know Regain, Rogaine for men, and it's generally just been used topically. And then CVS and some of the pharmacy brands brought out the female version, which is a lower percentage, the topical. So it's been used.
And why though? But why do they give women a lower percentage?
I think just because, I mean, the men probably need a higher dose for their alopecia as opposed to us. Okay. So minoxidil actually is quite interesting. It's also an old-fashioned blood pressure medicine that we never use. Yes. But the actual topical application is a bit of a pain. It usually comes in an alcohol base.
It's very annoying.
It's very annoying.
I can attest to that. Yes.
How do you I've never used it.
I know. I feel like I should be asking all the questions. Sure, someone who has really suffered from hair problems.
How do you do that? Do you do it after you wash your hair and you're styling?
Yes, and you
do it. Does it make your hair filthy?
They want you to do it twice a day. I like to do it before I go to bed, and then I find that it actually. So yes, it looks greasy when you put it in, even though it's not. It's just because you got your hair like a little wet looking. If I blow dry it after that, it makes my hair crunchy.
Yes,
almost.
Correct. It makes it crunchy, and it almost it's not quite as bad as hairspray, but it just you can't run your hands through your hair like you normally would. It crunchy is a very good word for it.
But if I put it on at night and then I sleep in it and I wake up in the morning,
it's not so bad.
It's fine. It is 1,000% fine.
Are you currently using it?
Yeah, I go on and off of using it because then I still have some more questions because then I tried this other hair shampoo and I have a couple friends who also have lost a lot of hair, and so we've had a lot of conversations about this.
Yes.
Well, how effective for y'all two has
it works for me. If I notice if I go off of it.
Yes, it's topically it's effective. But it's a pain because you have to keep...
It's annoying.
It's annoying.
It's very
Absolutely. So the last couple of years, we're using now oral minoxidil for women. And
one of my friends is on that right now.
Yes, correct. So
her hair looks fantastic, by the way.
So this has probably been one of the most successful ones that I've used. This is for generalized hair thinning, especially the GLP and the COVID related. It definitely helps bring hair back. And it brings it back everywhere. So minoxidil doesn't work on the hormone-related hair loss. It's going to work really well on generalized hair thinning. And then it's a really, really tiny dose. It's a 2.5 milligram, which is tiny, and you can break it into half and a quarter. So we generally recommend people take a quarter daily. And then some people find they do better on the half. Some people find they do better on the quarter. So I generally recommend do a quarter for 3 months and see how you go. If you're not getting the results you want, then go on to a half. And if you don't like that, you can always go back to a quarter. But those doses don't drop your blood pressure down. So
any side effects?
No, that would be the only one, would be low blood pressure. But it's such a tiny dose. I mean, even the 2.5 is hardly going to touch your blood pressure. So there's a different dosage for men, which I can't think of off the top of my head right now. But for females, I'm using a lot, and it costs nothing. I mean, it's generic. Oh, wow. You can get it from your pharmacy. So I've had very positive results from patients. People come back within 3 to 6 months and say, oh, my gosh, my hair's all growing back.
So you just it stimulates new growth? Mm-hmm. Okay. Let's get you on this and do a study.
We should. So, but my question is is what Carolyn said, what are some potential side effects, or are there people who should not take it? And here's why I ask, because it is very easy to get a prescription. You can go online to one of those online doctors that is not even your regular doctor and tell them what you want, and they'll just give it to you.
His and Hers or Him and Hers are probably the biggest website that does it. Exactly. Obviously you can get it online. The other thing that Him and Hers does is a lot of the topicals. So they will compound like a minoxidil with a finasteride, for example. So finasteride is a prostate medicine, that we use for men. It's like an alpha reductase inhibitor, and so it works really well for males. For male hair loss, but we don't like using it orally for females. Some dermatologists do give it, and as you say, you can get it online. Yeah. But I tend to prefer using finasteride topically if you're going to use it. It really is more of a drug that we use for men, but some women do really well with it. But you're quite right. You go on, you fill in a questionnaire online, and you can get them to send it to you.
So what medication?
Oh, it's Propecia. Sorry.
It's Propecia, correct.
I was just looking up Propecia because I know a lot of people have taken Propecia, but I have had men tell me that
does it affect them
sexually? I was trying to think of the correct way to say it that was appropriate. Yes, thank you. I was going to say something so much more crass, and I was just sitting here blank face, don't say what you want to say, Brierley. Yes. So I have heard that it can have oral sexual side effects.
Yes, and some of the men that I know that have been on it, say from a dermatologist or somebody, will tell me they just don't feel great on it. So, some men do really good on it, some people don't. But then again, topically it works pretty well just as well. So it is a good one to add into a topical.
And you could combine it with minoxidil?
Mm-hmm. So the compounding pharmacies, I remember asking one of our local compounding pharmacies maybe 10, 11 years ago, this is long before Him and Hers and everything were out, if they could compound minoxidil and finasteride. And they did try, but oh my gosh, it smelled like rotten eggs. It was terrible. But I think the compounding pharmacies now have got it together where, they're able to compound
it's better.
Yeah. And they can do various combinations of things. But finasteride is an option. It's more for men than for women. But as I say, topically, if you are struggling with hair loss, it's not a bad idea to try it. You can do...
Is there any reason why you wouldn't just start with oral minoxidil? What is it?
Minoxidil.
Yes. No, you can start with oral. And it works really well just for generalized hair thinning.
What if I don't come to you? I'm not going to take it, but I get online and do one of these things. Is there anything what if I was already on a blood pressure medication? Would that be a reason not to take it or to go to your real doctor?
It would be better. Okay. It's okay. You'd be adding it. It would be additive. So if your blood pressure started getting a little low, that would be the real problem. Then when you were taking a half, then obviously take a quarter. Gotcha. I guess you could maybe even do a quarter every second day. But the minoxidil doesn't really drop your blood pressure as much. Spironolactone may do it a little bit more than, but honestly, we've got hundreds of patients, women on spironolactone. The OBGYNs and the dermatologists usually start at 100 milligrams, and it doesn't matter if you're 100 pounds, they plonk you on 100 milligrams, and most of the patients seem to do pretty well with it. It's just the potassium you have to watch out for with spironolactone. So if you also on other diuretics like hydrochlorothiazide or Lasix, you really need to let your doctor know. I'm also taking some spironolactone for my hair.
Yeah.
And then, of course, the other thing, which is huge, has always been around, Nutrafol, for example.
Right,
with the dietary hair supplements, obviously that's a huge booming business. the main thing that's in all of those is biotin, so that you're giving yourself some building blocks. The biggest problem we have with patients taking biotin is they come in to get their thyroid levels checked, and it interferes with the lab value. So you get all these wonky lab values. And the first question we ask is, are you on a hair loss supplement? And 9 times out of 10, they'll say, oh, yes, I'm taking Nutrafol or one of the others.
Wow, so, I had no idea. They didn't teach us that in school.
I had no idea.
So it doesn't affect your actual thyroid. Like, it's not going to make you suddenly get hypothyroid, but it's going to affect your lab values. And so generally your lab value, your TSH looks as if you're too low, and it also usually makes your T3 look a little low. So I can almost look at the labs and go, oh, I bet you she's on Nutrafol or biotin.
Interesting.
So we generally ask people just to stop it for a few days before getting their labs done, because it gives us incorrect lab value.
Okay.
So the thing about treating hair is, I think it's good to do it from a multi-dimensional point of view. If it's looking hormonal, for example, do spironolactone, but it would be good to make sure the iron level's okay and add iron in if you need it. And definitely using a good hair and nail supplement that's got some of the vitamins and the biotin in. I mean, it's going to give you a building block.
Is there one that you like in particular, or one that you look for?
Yeah, I mean, Nutrafol, I guess, is really the gold standard. Okay. It is expensive.
It's very expensive.
And that's a big negative for it. They also do a pretty good job in terms of like having it for postpartum, post-surgery, perimenopause, postmenopause. So they've got different formulas, which are, kind of quite scientifically done. But there are plenty of other ones available. So it really, I guess, just depends on your budget.
Yeah.
Okay, so how about there's a shampoo? I know there are shampoos out there.
Yes.
So like I have used a brand called Nioxin before, and I was just looking it up to see what was in it.
Yes, and that's the other thing. Yes. So Nioxin, I think it's got ketoconazole, doesn't it have in it? Is it
niacinamide?
Oh, it's got niacinamide.
Peppermint oil, caffeine.
Okay, yes. So actually, shampoos are probably the least effective. However, Nizoral, I was getting confused with there. So that's the other thing.
Nizoral?
Using something that's got ketoconazole in it helps with hair loss. I forgot to mention that. Yes, like an anti-dandruff shampoo, but not the zinc pyrithiamine, like in the heads and shoulders. You really need the ketoconazole.
Okay.
So the ketoconazole also works on the hair follicles. I think it works with the DHT, if I remember correctly, if you're looking it up there. Yes. That was the other one I forgot to mention. So, and that's the other thing. A lot of times you can almost tell that you're going to start losing your hair because women get like an itch on their scalp. Like a sort of a tingling, itchy, weird feeling. And you might think, oh, gosh, I'm getting dandruff or whatever. But the ketoconazole actually helps quite nicely with that.
Yeah. Interesting.
And then, of course, if you've got like patches where you're losing hair, sometimes you'll use like a steroid, like an oil. You can get a thing called Dermasoothe, which has got betamethasone in it. It's like a scalp oil that's got a little steroid in. So if you're...
Interesting.
And that can help as well if there's a little bit of inflammation going on. Because there's all this sort of new thinking in terms of how it's at the follicular level and inflammation, and so you're trying to calm that down. So steroids do have a part to play as well. Dermatologists will inject, like, for example, if you get different patches of sort of little alopecia or hair loss, they might inject some steroids directly into the lesion, which can help stimulate hair growth.
So do most of these treatments that we've talked about, they work by stimulating hair growth? There aren't really any that stop the hair from falling out. You're mainly just stimulating hair growth.
Well, I think the research and the goal, if we're going to get any new hair products, will be to try and work on the inflammation that's starting.
Lower that so it doesn't fall out. I got you.
Yes.
Got it.
And I think that's really where the COVID thing has been, that inflammation at the follicular level. Wow. I mean, it's just the weirdest thing. Well, even somebody who's had a fever for 3 or 4 days, you can start losing hair. Usually it's 3 months afterwards. It's all to do with the hair cycle.
Oh, got it. Okay. All right. Now, what about the platelet-rich plasma that dermatologists will do for you, which is expensive? I know, Carolyn.
Yes.
I feel like Carolyn and I. Carolyn and I really should have talked in advance about this because I have a lot of questions.
Yes.
It's expensive.
It's very expensive. Yes.
So can you explain what they do exactly? Because I don't really recall, but it's a cosmetic treatment, and they take your.
This is one where they take your blood first.
Yes.
And they spin it. Yes.
And
then they inject it back into your head.
Correct. And so you can, and that brings us the topic of, there was a phase where people, you know how you do microneedling on your face?
Yeah.
And you put in like little growth factors or, some of there was that whole thing, the vampire facial, where you spun it down and took your own blood, and it's really the growth factor that you're trying to put in. So there was a phase where people would do like microneedling on your scalp actually, and put in some of those the platelet-rich plasma. I haven't had any patients that have done it in a while though.
Yeah,
but
bloody.
It does. I mean, it makes sense in theory,
right?
But I'd have to do a little bit more research on that. I know the plastic surgeons and the dermatologists are moving more towards that red light therapy, that cap.
I was just going to ask you. That was my next question.
Yes.
What was the red light therapy cap for your head?
Yes. So
this is what happens when you've been blessed by such great, thick, beautiful hair.
Oh, no, look at it. I didn't even see any hair thinning going on over there. It just looks gorgeous.
Oh, thank you.
Glossy, straight. Oh.
Yeah, I know.
Beautiful.
Genetics.
Oh my goodness, there's hats that look like ball caps.
Yes.
That have red light in them. What?
Yes.
So what's your verdict on that?
Yes, so that's also working, I think, at the follicular level, trying to heal up your follicles and decrease inflammation and stimulate hair growth.
Okay.
So, yes, I've got patients who do it. We've got a local plastic surgeon in Tuscaloosa. She specializes in it. The big drawback is the cost.
Yeah. Right.
I think it's, something like $3,000 or something. I don't know for how long, but it is expensive.
Yeah.
The cheapest baseball-looking hat, hat looks normal, most normal, is around $500.
Yeah.
Yeah.
And they go up. I don't even know if $500 is strong enough.
I know. I've just got in my mind $3,000. One of my patients told me about it. But as I say, that's the big thing with it, is obviously you've got to be consistent with it, and it's the expense.
Right.
So I just haven't had enough experience with it to know whether it's worth it or not.
Yeah. Well, not that this is specific to what we're talking about, but I will, in terms of putting things on your head, I do know a couple of people who have done the cooling cap when they've gone through chemo.
Oh, yes.
It might not be called cooling cap, but that's what I'm calling it.
That's what it is called, yes.
Which is very expensive, but works.
Yes.
I know 3 people that have done it and were able to preserve. They had thinning. Yes. But not excessive thinning.
So that's interesting. So you're using kind of sort of similar to like going into your cryo chamber, for anti-aging. Mm-hmm. Yes. Mm-hmm. Interesting.
Yeah.
Yes.
Yeah.
Yeah. What else?
Well,
I know you've got all the latest and the greatest. Yes.
I think that's it. I think a lot of it was supplements. Obviously, the oral version of like minoxidil, which is so easy to get now. The infrared. One of the things I would be curious about is the infrared cap does it have to be like that proximity to your head, or like would going in an infrared sauna yield similar benefits? Maybe not similar, but would it yield some benefit?
That is, well, it's going to yield benefits systemically and decrease generalized inflammation. But I think with a cap, you've got to have it going directly into those hair follicles. Yeah. Yes. I mean, I think the takeaway from all of this is there's a lot that can be done about it. And there's a lot of causes and reasons for it. I mean, even things like COVID hair loss, GLP hair loss, the good news is your hair is going to grow back eventually.
Right.
When it comes to, say, female pattern alopecia or hair thinning and the sort of hormonal, I mean, you've definitely got to do a little intervention to help it. Otherwise, it's really hard for it to come back. But the way, just in my practice at the moment, I would say the number one in terms of patient satisfaction, in terms of generalized hair thinning, has been the oral minoxidil. People come back within 3 to 6 months and go, oh, yeah, I'm growing all my hair back. And I think, it's important to add in the other things, make sure the iron's okay, the thyroid's okay. I definitely think it's not a bad idea to take a hair supplement that's got some biotin in it. And it's not going to harm to maybe use like a ketoconazole shampoo, every week or so as a baseline, or once every 2 weeks. And then just when you were talking about the shampoos like the niacinamide and the rosemary and the tea tree oil, those are all kind of stimulatory. They decrease inflammation at the hair follicle root, and they also get rid of maybe some of the fungal dandruff things. That's why those work. I mean, tea tree oil's been used for years, peppermint oil, and kind of stimulate blood supply to the scalp, that kind of thing. I mean, I think if you're starting to get resistant hair loss and you're not winning on anything, then it would be worth looking at the red light therapy and possibly the PRP, the platelet infusion stuff. Although that is also very expensive, and there's no guarantee that it's going to work.
Yeah.
So I mean, at least there are options, and we are seeing people growing back their hair, which is good.
Yeah.
Yeah, the options seem a lot more
than they used to be.
Effective than than I anticipated you telling us.
I mean, I didn't even know that Propecia was something that women could even take. I mean, I'd only known men could take it, and then now obviously the oral minoxidil is a big game changer.
Right.
Interesting. All right.
Yeah, well, thank you.
Oh, yes.
We always love having you, but this was really, really helpful.
You.
Thank you so much for joining us for the Happy Eating Podcast. I'm Brierley Horton.
And I'm Carolyn Williams. If you liked this week's episode, then don't forget to rate and leave us a review on iTunes. And be sure to hit the subscribe button so you'll never miss a new episode.
We can't wait to have you back at our table next week for a brand new episode. Bye.
The contents discussed in the Happy Eating Podcast, such as advice, studies, text, graphics, images, and other material discussed or presented on the site or podcast, are for informational purposes only. Content is not intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your mental health professional or other qualified health providers with any questions you may have regarding your condition. Never disregard professional advice or delay in seeking it because of something you have heard on the Happy Eating Podcast.
If you are in crisis or think you may have an emergency, call your doctor or 911 immediately. If you're having suicidal thoughts, call 1-800-273-TALK, that's 8255, to talk to a skilled trained counselor at the National Suicide Prevention Lifeline. If you are located outside the United States, call your local emergency line immediately.